Okay, well, hey everybody, I'm so wicked excited to have Sharon Bonifazi be our interview highlight, or spotlight rather, for the September newsletter. And I'm not going to, jam her on too much, but I am really excited to let you know that Sharon will be one of our speakers at the Science and Soul Conference in 2019 in our Spotlight section, which is a new bit that we've added to the Science and Soul Conference to really kind of highlight those folks that are out there doing the amazing work, really touching lives and just, doing it at the front line. So I'm wicked excited to turn the mic over to Sharon and have her introduce herself and share a little bit of her own background. Okay, go ahead.
Hello, thank you. Thanks, Mary, for inviting me. I'm very honored to be to know you, and I'm even more honored to have been asked to share my journey at the Science and Soul Conference in 2019. So I'm really excited. I've never been to Europe before, so it'll be a new experience for me. My name's Sharon Bonifazi. I've been a nurse since 1999 and really fell in love with the NICU right away from the get-go. I went to nursing school after I had 4 kids, and my goal was to be a labor and delivery nurse. And once I stepped foot into the labor and delivery unit as a student, I thought, oh, maybe not so much. But maybe 6 months later, I did a rotation in the NICU, and I'm telling you, it was like a experience, almost an out-of-body experience when I went in there. That's really stretching it a little bit, but I went into that unit and I was just like, oh my gosh, this is where I'm supposed to be. This is it. This is what I'm going to do. Yeah. And at the time, I didn't really think about the fact that I was a preemie myself and started my life in a NICU. So I don't know if that has something to do with it or not, but I felt right at home and knew at that point that that was my goal, and I didn't want to do anything else other than NICU nursing. So awesome. And that's where I've been ever since. I was so blessed to start my career at Loma Linda University Children's Hospital in Southern California, where they do extraordinary things all the time. I learned so much, met a lot of great people. And then our family actually decided to make a change, and we moved to the Central Coast of California, and now I am working as a nurse manager at Sierra Vista Regional Medical Center in San Luis Obispo, which is an awesome place to live and visit. If you ever get a chance, you should come.
Oh, it is beautiful up there, yes.
It is gorgeous. It's right in the middle of California, right along the coastline. So we are so blessed to live here, and my work's a little bit different than it was at Loma Linda, but still love it today and love our nurses and the patients that we work for.
So that's a pretty powerful history then of work experience from from a novice nurse, and now you're a nurse leader, a nurse manager in a medical center. That's really amazing. How big is your NICU?
We have 22 beds.
Nice. Level 3, yeah?
Level 3, yep. Community level.
Yeah,
fantastic. So we take anywhere from, the tiniest babies, 24, 25 weeks, up to, large babies that are sick that we also have a cooling program that we are working on, and we have had some good success there. So we're
that's amazing.
Yeah.
So how, having that background, as a frontline clinician and now as a manager, how important has this idea of developmental care, or as I like to call it, trauma-informed care, how important has that been in your practice?
Gosh, I think it's been huge. It's everything. And I know that when we were introduced to it, or when I was introduced to it, back at Loma Linda, we did have a NIDCAP trained nurse that was the leader of the developmental care work that we did there at the time. And, she really kind of drove everybody crazy. But I still remember her, and she made a lot of sense, Yeah. And I learned a lot. The beginning part of my orientation, I was kind of shocked at some of the way we were doing our care, but not realizing why I was shocked by that.
Yeah.
I remember what we now would consider the preemie flip.
Yep.
Being like one of my very first experiences. And I'm telling you that my preceptor was wonderful. And I think she was doing what she thought was best at the time. And, but intuitively I knew, gosh, there's just something wrong with this. It really literally made me gasp when I saw it.
Yeah.
And so it just started me on looking at, okay, how can I do this better? And really right away, I think I tuned into the fact that I really needed the parents to be part of the care of the baby. And so that was really my, probably what I became known for really was that I could work with all types of parents and what some people would consider difficult.
Yeah. Well, I mean, that is so crucial. That's, I mean, they're kind of like the turnkey, right? The parents for this whole idea of developmental care. It's really about parenting the baby. So that's amazing. Now, in your role as a leader, how has your view or your opportunities around developmental care changed? Or, is anything different, now that you've got this new role?
Well,
I know it's not new for you. I know you've been in the role for a little while, but
no, but it does still feel new, right? Like I think maybe it was a week or so ago, I walked into the unit and one of the babies was crying and the nurse was looking at me like, please help me. And I was able, I forget why I even walked in, but I was there for some reason, but what ended up being the best reason was I got to pick up that baby and spend some time with him so that she could take care of her other baby. So I think I don't get to get inside of the unit as long or as often as I like. But what has been good and what is great is that I get to bring in new people. I'm able to hopefully have some influence about the direction of where we're going with the help of Donna Loper, who's our CNS there at Sierra Vista. We have restarted our developmental care committee this year, and they are so excited and are doing great work. And I just think actually I'm getting the goosebumps thinking about them.
Oh, cool.
They are so excited and so just engaged and really taking new concepts even about developmental care. Yes, we're talking a lot about positioning because it kind of blows me away that we're still talking about positioning after all these years. But that's a big part of it. And because of them, we're ordering all new developmental positioning aids. And we're going to be getting some great teaching from our physical therapist.
Nice.
So that will be a great help to the nurses at the bedside. So I think because I support that practice, I'm able to move that forward with the hospital and justify the reasons why we're spending this time developing these programs. And so that's been great. And, being at the bedside is wonderful on a different level. Yeah. But when you get to actually have an influence over where your unit is headed, that's also very, very inspiring and wonderful.
It sounds to me like you actually now have transitioned into a role where you can be a champion for your frontline colleagues, and since this is a passion of yours, that you can really kind of be that spearhead for it and really keep people moving in the right direction. I mean, it doesn't matter where you start as long as you start someplace,
right, right.
And then just keep making those positive strides. That's so cool. Right. So we talk about the developmental care, and I know, I've got this thing about trauma-informed care. What are your thoughts about that concept? And you can say anything, I really want to know, what do you think about this concept?
I think trauma-informed care encompasses many areas, and it's not just about the positioning of the baby or the development of it. It's a huge part of the developing brain, but it's also about the family, the environment that the baby's in, the environment that the family's in, and how do you minimize that trauma? Because like it or not, the minute you're separating the baby from the mom, before time is ready to do that is trauma. It creates trauma. And so anything that we can do to minimize that and help our babies and our families get through that time period, I think will only help to impact that baby and that family's life.
Yeah. Oh gosh, that's so, well, I mean, that's so nice to hear you say that, because of course that's what the conference is. You know, it's the second annual conference now for trauma-informed, and we're now calling it trauma-informed neuroprotective care, which is really, really cool. So, and also I like what you said, that it's, you know, it's the baby, but then you also included the family. And now really we've added the clinician as well, because I think, you know, we're starting to really understand that bearing witness to these really difficult things affects us as well as clinicians. But we're tough nuts, you know, and we just stuff it down and we don't want to talk about it. And we're just, you know, this is just what we do. But I think we have to honor that if we're going to really help the clinician do the good work that you know that they want to do, you know, that's inside their heart and soul, you know, and like, just like what you said, you know, and you know, the words that you chose, you know, at the beginning you said, oh, that sounds really, you know, out there, but no, it doesn't, because when you find your calling, I think, especially in healthcare, right, as a nurse, it is such an important discovery for you, because then that you're fueling your passion, right, by working in that setting. So what, you know, given your experience and your views on this, is there one thing that you could tell a NICU clinician that they could change in their practice today? Something that you think that really they need to focus on? What do you think?
I think that if I was going to pick one thing, and it feels a little bit broad when I say this, but this is what rings true to me, is to stop providing routine care without intention.
Yeah.
We need to be intentional in everything that we do. And we think of these ordinary days that we have and ordinary circumstances of changing a baby's diaper. And these are things that need to be done, but we need to be going to the bedside. And I've learned this from you, actually, and listening to you. And actually, I've seen it in practice in our unit, where I can see the nurse that's going to the bedside with intention in her mind, and her thinking about what she's doing before she does it. You know, talking to the baby and knowing what you're doing. Because we all have things that we're coming to work with, right? Like, we had a bad day, we overslept, we underslept, we're working the night shift, it's our 5th night on, whatever is happening. But when you go to touch that baby and you go to provide that care that's so important, that you need to be intentional about what you're doing, and all these things that we talk about, positioning, skin to skin, feeding the baby, making sure that they have enough sleep, or, oh, guess what? The IV's now come out and we need to start an IV on this poor little baby, whether it's a tiny baby or a full-term baby. This is a painful experience for them, and we need to think about what we're doing before we do it, and do the best job that we can. And as in practical ways, I would say, stop trying to do everything by yourself. Yeah. Because you think you have to do it all, because you don't. You know, what we're really talking about at Sierra Vista in our developmental care committee meetings is really thinking about more of a team-based approach, where this isn't your 3 patients or 2 patients that you're assigned to for the day, but everybody in that room is part of that patient's care. Nice. And so we're trying to change that way of thinking. And if anybody sees this interview, they might be surprised, because we haven't really rolled it out yet.
Yeah, but it starts.
We're talking about.
Yeah, it starts with the discussion, right? It starts with the recognition. And when you said intention, you gave me goose flesh. I mean, that's exactly what it is. And what a nice segue into what you'll be talking about at the 2019 conference. You don't have to, expose too much, but it really touched me when you shared your paper about how you viewed the work that you do, and it was so heart-centered that I felt like, all right, the whole world has to hear this, because this is really, really important stuff.
Yeah, I've been on a journey, really, probably it probably started 2 years ago, or a year and a half ago, when I attended the one conference that Synapse Care puts on every year. And that's when I got the courage to come and speak to you. But it really started there. I was at a time in my career where I was feeling like, what am I doing? This is just, what does this mean? What's my purpose? What's happening? I'm, just going to work every day, same thing, different day, really feeling kind of discouraged. And that's not really the person that I am. Mm-hmm. And it was pretty difficult. But one thing that had happened is I was in a leadership meeting, and my boss at the time asked about a situation that we were following up on. And I said something like, well, I hope so, I hope it's going to work out, or I don't even remember. It's so funny what it was about now. But right away, she just told me, hope is not a plan, Sharon. And I just went, no, it's not. But for some reason, I was so offended by that. It offended me to tell me that. And I thought, no, it's not. Hope is not a plan, but it is important. Yeah. And so it took me quite a while to get to where I am now. But as far as the journey surrounding hope, but every time somebody would say that, because it became this like a little bit of a mantra in our leadership group, and it became a little bit of a joke. When someone would say something and you'd go, hope is not a plan, hope is not a plan. And every time somebody would say that, it was like nails on a chalkboard for me. And I just, as time went on, I just started exploring that. Why does this bother me so much? Because it's true, right? Yeah. Hope is not a plan.
But it doesn't mean it's not important. Yeah.
No, it is important. And so I started thinking about what tangible ways we can put hope into practice every day in our work and everything that we do. So that's what I'm going to be talking about.
And it's absolutely beautiful and inspirational, and I don't want to give it away. So we'll wrap it up there. And I hope, I thank you very much for sharing your time with everybody here and with myself and everything. And for everybody who's watching this, you've got to come to Bruges. I mean, gee whiz, if for no other reason. Yeah, right, Sharon? You've got to come to Bruges and find out what it is that this woman is talking about, because it will change your life. It is super important, and as is, the rest of the conference as well. We've got amazing speakers, and I'm just really blessed and excited, to be part of this, and to have so many really important people also want to share in the experience. So, thanks again, Sharon. You have a fantastic day, and
thank you.
Be talking to you soon. All
okay.
right.
See you later.
You take care. Bye bye.
Okay. Bye bye.
Thanks.